Hello and welcome. I'm Dr. Adam Dorsay, a psychologist in Silicon Valley and the host of SuperPsyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. SuperPsyched is your tool to get more of what you want in your life and less of what you don't. Nearly 1 in 4 Americans suffer from chronic pain of some kind. And now, for the most obvious statement ever. Pain sucks. When we're in pain, it can color every part of our lives. Our thoughts, moods, and capacity to experience joy are just some of the aspects affected by pain. Sometimes standard forms of care can be helpful, but for many people, medication or surgery results in trading one problem for another. Thankfully, people like my guest have come up with valid and sophisticated methods to assist a large percentage of people who suffer from chronic pain without the risks of medication or surgery. Dr. Howard Schubiner is a physician who is at the forefront of looking at a well-researched treatment modality called pain reprocessing therapy, also known as PRT. This is Howard's second SuperPsyched interview, and this time he's sharing his new and updated book on PRT called Unlearn Your Pain. Listen in as Howard unpacks his methods and engages in another discussion about unlearning your pain. Dr. Howard Schubiner, who has asked me to call him Howard, welcome back to SuperPsyched.
It's so good to see you again, Adam. I'm glad to be here. It's always fun talking with you.
It is, my gosh. I mean, from the moment I met you, I felt such a kinship. And I got to tell you, your episode from a few years ago is one of the most downloaded of my episodes of all time, of over 300. So all I can say is your message is really landing. It's incredible to hear your name thrown around in the zeitgeist as I do, and it's always positive. And understandably, people are really excited about your work. I just wanted to, for the people who aren't familiar, who may be hearing your voice for the first time, to just share a little bit about your medical journey, including your connection with Dr. Sarno, which kind of feels like Yoda and Dagobah with Luke Skywalker.
Well, it wasn't that momentous at the time, but I just fell into this work at the right time and the right place in the world, in the universe, and for what was happening with me personally and in my career. I just happened to have a certain set of skills because I had spent 18 years as a medical school faculty person doing research and analyzing data and teaching and developing clinical skills and all sorts of stuff for 18 years. And then I left the university and I moved to this private community hospital. And I didn't know what to do at that time. I was like, maybe I'll just coast. Don't know that academic medical school stuff. And then my good buddy, Ernie Yoder, was my boss. He said, you should read this book by John Sarno. I'd never heard of him, right? And my friend had a friend who had severe back and leg pain. She read Dr. Sarno's book. Her pain went away. Now, what the heck is that? What does that mean? How does that happen? And at the time, Ernie knew I'd been studying and teaching mindfulness meditation. I was interested in the brain, et cetera. Anyway, so I called up Dr. Sarno and I said, hey, can I see what you're doing? I read his book. I said, I read your book. It's remarkable what you're talking about. That is not new that the mind affects the body, but it is new that giving people this kind of information and helping them understand it can help turn off pain and other symptoms. So I went and visited with him for a few days and we connected. He signed a book for me and I went back to my hospital and I said, hey, Ernie, my boss, can I start doing this work? I want to see if it works in somebody else's hands. And he said, sure, go ahead. So I just started practicing.
And if you were to, on an elevator, explain very briefly, because of course we're going to get into it, what Dr. Sarno's message was, how would you encapsulate it?
Yeah. What Dr. Sarno stumbled on was the fact, and he was mostly seeing people with back pain and other pains. And what he stumbled on was the fact that some people had horrible pain and relatively mild or normal MRIs of their back. And other people had no pain at all and relatively severe abnormalities of MRI in their back. And that disconnect is puzzling, doesn't make sense. And so if you look at how the brain works and the fact that the brain is neuroplastic, it organizes itself to create new pathways. These pathways can be new habits, how to play the guitar, how to kick a soccer ball, and they can be habits of having pain in the absence of actual tissue injury, because stress and emotion activates the same parts of the brain as does a physical injury. And our brains create what we experience. And so putting all that together, sometimes people with pain don't have an injury. And when you help them change the neural circuits in their brain, pain goes away. Magic.
On the flip side, sometimes people with an injury or with symptoms, profoundly pathological backs, don't express symptoms. And one of the things that really captured me, I remember, of Dr. Sarno's work was the idea that people during their earning years expressed more symptoms than people with more pathological backs in retirement communities who were not working and earning and feeling the burden of earning. So it's amazing how the mind-body connection works. I remember in the 90s when Bill Moyers came up with this video series on PBS, the mind-body connection. It seemed super woo-woo. It was really, a lot of people kind of rolled their eyes, and now it's just accepted as normal. We now know with irrefutable evidence that even rejection can hit the parts of the brain that pain hits under neuroimaging. So that's to me, that is amazing. Can you just give a scenario in which a person learns pain throughout their life? And in as much as we can learn the guitar, as you say, we can also, I think, learn pain without really our own consent. It's not like we say to ourselves, you know what I'm going to do? I'm going to have a life full of chronic pain. Yeah. I mean, God, no one would sign up for this. Anybody who's been through chronic pain knows it is absolutely devastating. But how might a person learn pain over their life? Is it okay to use the term?
Our brain creates our experience. You can have, as you mentioned just a second ago, you can have a significant injury and have no pain. So our brain controls whether we have pain or not. Stress and emotions activate the same parts of the brain as does a physical injury. So you have a child who's growing up and things are going well, and then their parents start fighting and have arguments, and they're arguing and the child feels endangered. So the danger signal in that little, let's say girl, that little girl's brain starts to create tummy aches. Why would it create tummy aches? Well, it's a danger signal. It doesn't speak English. You can't tap her on the shoulder and say, my dear, you're freaked out because your parents. Gives her stomach aches. And what do the stomach aches do? They help get her parents to stop arguing because they have to attend to her. This is totally unconscious. She's not consciously doing that. It's not faking. And then she grows up. And then let's say she's in her teen years, and all of a sudden there's online bullying or mean girls or controlling romantic partner. And then she starts getting migraine headaches. And then the doctors are like, well, you need medication for your migraine headaches. Why do I have migraine headaches? Well, it's probably genetic. It runs in your family. Except they're not asking, what's going on in your life? Then she gets in her mid-20s and she marries some guy who turns out to have an alcohol problem and turns out to be kind of harsh with the children. And now she starts to get irritable bowel syndrome and maybe pelvic pain. And she goes to doctors and they give her special diets and they give her pain medication, but they're not asking about this whole lifelong pattern. And then in her 30s, she divorces a jerk, but he's still trying to get custody of kids. And then she gets in a fender bender accident. So there's injury to her neck. And now all that danger in her life with the ex-husband and the custody or whatever that stuff is, channels into neck pain, and then the pain spreads down her back to the rest of the back. And then the MRI shows there's some abnormalities of the back, but what they don't tell her is that everyone her age has these same abnormalities as a normal finding. Then she's not getting better, and she's got all these things piled up, and it's so sad. And it's not her fault. She's not crazy. She's not weak. She's not mentally deficient. She is a human. And her human brain is trying to alert her to these different dangers in her life. And then she starts to get anxious because the pain is there all the time. And then she starts to get depressed because the medications aren't working or the injections aren't working. And the doctors can't help her because the hero of the story is her.
That's right.
And she realizes and she learns that neuroplastic changes in the brain are responsible for her symptoms going back to her childhood. And all the different times and issues that she had in her life are not her fault. They're things that happened to her. And there's a way out because neuroplastic neural circuits in the brain can change. And we've developed a couple we can talk about. We've developed several methods of how to help people change neural circuits in the brain that have been shown in high quality randomized controlled trials to be effective. I don't know. That's what it sounds like. I mean, your heart just goes out to her, right? I mean, this work is about caring for people, seeing them in their wholeness, not just seeing their and validating their disease, but seeing their life and seeing them as people.
Howard, Brene Brown describes compassion as empathy plus the desire to reduce suffering. And when I think about the heart of your work, it is compassion. It is the desire. It is empathy plus the desire to reduce suffering. And as you were describing this poor woman's life, I don't mean to say this in any condescending way. I mean, I feel so much compassion for this woman who unwittingly caught all of these symptoms throughout her life. It became, I wrote down 3 words, a fomenting, overwhelming blob. That's the best way I can describe it. It feels like a 1950s horror film of this just overwhelming, growing thing that is taking over her life. And this woman doesn't know where to even begin to shoot.
Yeah.
And yet you're suggesting that it all contains the same root cause, all of these symptoms.
All of these things have the same root cause, basically different variations depending on different situations. Some people have major ACEs, major trauma. Other people have smaller things, but nevertheless, they can all add up. And what's happening with these conditions, chronic pain conditions, as I mentioned, the ones that I mentioned in this little scenario, anxiety, depression, chronic fatigue syndromes are all increasing in society. They're not well treated by traditional medical routes. They primarily are affecting young people, teenagers, people in their 20s, 30s, 40s, and 50s. And there is a predilection for women. And as soon as you say, well, women are more affected, women will be blamed because traditional medicine has been highly patriarchal. Our societies have been highly patriarchal for centuries. And it turns out that women have higher rates of emotional abuse in children, higher rates of sexual assault, higher rates of online bullying, higher rates of sexual discrimination, harassment or discrimination in the workplace, higher rates of intimate partner violence, higher rates of caring for the older generation and the younger generation and doing more of the work at home. It's not surprising to me. And I wouldn't have thought of this originally going into this work, but when you see it day after day and you hear the stories and you see that our society has injustice in it, higher pain levels in immigrants, in the vulnerable, in people with different gender identities, minorities. So it's just so connected. A lot of ways, pain is a social justice issue. And, I don't say that a lot, but, I grew up in the 60s and 70s, and there was all these movements that were social justice movements. And I don't know, I just feel like it's kind of coming around.
And it did not escape me that you used a female for this particular vignette. And yet, of course, men too, and people identify as males, and all genders can be affected similarly. You and I both grew up with a lie. And that lie was sticks and stones may break my bones, but names will never hurt me, or words will never hurt me. That's BS. You and I both know, based on your vignette, that words can hurt profoundly. In some cases, can even be worse. Christopher Nolan, in his great movie, inception, said there is nothing more durable than an idea.
Yeah.
And I thought that was incredible. That was just that was one of those gems that could only be thrown out by a true master. And at the heart of your work is that idea, this durability of ideas, this durability of the names that and words that can really hurt. You talk in your book a bit about the perfectionism, particularly for females online, and how much it's gotten worse in recent years. So I think that it's really important that you do call out how badly females are treated, and it's not an even playing field.
In terms of words, I have a chapter in the book on placebo and nocebo effects.
Right.
And it's really amazing how powerful the brain is. People really never underestimate the power of the brain to produce symptoms. There's a story in there about a guy who was in a research study for depression, and he took his whole bottle of antidepressant pills, and he realized, oh my God, I overdosed. He drove himself to the hospital. He walked in the door and said, help, I've taken all the pills. And he swallowed the whole bottle of pills. His blood pressure was low. He needed IV fluids. He was weak, sweaty. They admitted him to the intensive care unit of the hospital. And they saw the bottle of pills, but it didn't have a name on it. It just had a phone number because he was in a research study. So they called the research study. He was in the placebo arm. Right. The power of the brain. If the brain can produce that, it can certainly produce pain, anxiety, depression, fatigue. And what happens in medicine is so often these disorders are because modern medicine uses primarily a biomedical approach. There must be something structurally wrong in the body because you're having these symptoms. And even severe symptoms can be caused by neural circuits in the brain. But when you go to the doctor with these kind of symptoms that doctors aren't very good at treating, doctors have made great advancements in cancer treatment and heart disease, stroke treatment in the last couple of decades. I mean, really some great advances, infectious diseases, but in these disorders, not so much. But what they do is they medicalize it because that's what they're told, not doing it to be mean, but you've got this disease, you've got that disease. Look at how bad your MRI is of your back. Look how bad all these, antibody tests are. And there's a lot of what we would consider inaccuracy and misdiagnosis that makes people worse, because it gives them the idea that they're ill, that they're really damaged and broken. And it often tells them there is no hope for cure. Your chronic pain is incurable. Your chronic depression is incurable. Your chronic fatigue is incurable. And that's the message they go away with. So they can feel validated that I'm really sick, that I have a disease. It's not all in my head. I'm not saying it's all in your head either. But if it's not actual disease process in the body, which most of the time it isn't, it is learned neural circuits in the brain that are real and that are reversible. So it's offering hope where oftentimes there was none.
Amazing. And I recently heard Ellen Langer differentiate between the placebo and the nocebo as the placebo is you get nothing, you think it's something, and then you get something. And the nocebo is you get nothing, you think it's something, and you get something. If you could just briefly describe the placebo versus the nocebo.
I love Ellen Langer. I wrote a chapter for a book she edited many years ago. I haven't heard from her in a long time, but
she's amazing.
Amazing. Her research is amazing. And Aaliyah Crum worked with her and then is now at Stanford and has done some other amazing research on how the brain affects the body. And it's one of the papers that Dr. Crum wrote, really seminal paper about how the brain actually can affect ghrelin levels, hormone levels, based on what you think you're getting. And so the nocebo effect is when someone, I can't tell you how many times I've seen people who came to the doctor with back pain, and then they saw their MRI and the doctor didn't tell them these are normal findings for your age. He or she said, these are really bad findings. Your back is really crippled. You're probably going to need surgery down the road. And their pain doubled just from seeing and hearing those words. You talk about the power of words.
You were basically saying that just by the mere expression from the doctor increase the expectation that they would experience symptoms, and lo and behold, they had more symptoms.
Yes, and that's been shown. There was a research study that was done in Britain where they gave two different randomized people to two different interpretations of the MRIs of their back. Everyone our age, everyone even starting their 20s, 30s, and 40s will have abnormalities of MRIs on their backs without any pain. It rises dramatically with age, just like getting gray hair. So to assume that's the cause of your pain is erroneous. But the study where they randomized people, where they gave half the people, they said, here's your MRI, here's all the degenerative discs, the bulging disc, herniated disc, spondylolisthesis, facet hypertrophy, all that stuff. That's what it is. And the other group, they said, here's what your MRI showed. And just so you know, these findings are also seen in normal people without pain. Just that one sentence. And there was a huge difference in how much pain people had 6 weeks later, how much they were likely to get an injection, if they were more likely to have surgery or not. All these downstream effects of simply the interpretation of an MRI. And Dr. Sarno told us this in the 1970s and 80s. This is not new data. It's amazing.
I'm going to tell you something very personal. 2 years ago, I was experiencing radiculopathy going down the leg, sciatica, which was really, really bothersome down my right. And I had a few injections. They didn't take care of it. And then I was scheduled for neurosurgery. I was going to get a microdiscectomy, which seemed very logical. Strangely, the day before the planned surgery, I got a call from the surgery center saying that my doctor had contracted COVID and we would need a delay.
Oh, wow.
And over time, and this particular surgeon told me that he very kindly shared with me that he had a similar condition and he actually didn't get surgery and that it did resolve over time.
Mm-hmm.
And lo and behold, mine did as well. Now, I am not in any way, shape, or form blaming neurosurgeons. I'm not discounting the power of neurosurgery. I think it's an important thing. But to date, I haven't needed that procedure. And I'm so grateful to not have needed that procedure because the procedure comes with costs. Would have weakened a portion of my spine by shaving away part of my disc.
Yeah, some people need back surgery. I'm not saying that no one needs back surgery. But people who have sciatica and radiculopathy often will get better, even when it's from a large bulging disc. They will often get better without surgery. About 95% of people actually get better. That's the natural history. But some will need surgery, especially if there's deficit in muscle strength, reflexes, sensation in the leg or in the foot. But what's fascinating is that if you go to a doctor with chronic painful condition, 90+% of the time, they're going to say there's something structurally wrong with you. And we believe that it's actually the opposite. If you take people with fibromyalgia is a real disease. People are really suffering. The pain is real. If it's accurately diagnosed, there's no actual damage in the body. Same with irritable bowel syndrome. Same with tension headaches. And I would argue same with migraine headaches as well. Some people debate that, but there's a lot of data on this, and I go through all of it in my book. But with back, so most of these chronic painful conditions are, for the most part, 90 roughly percent neuroplastic. Okay, what I would call neuroplastic or generated by the brain. They're real, not fake, not imagined. With back pain, because everyone's MRI is going to be abnormal, 95+% are going to be diagnosed as structural. So we did a study with 222 people, random people coming into a doctor's office for chronic neck and back pain. 98% of them had abnormal MRIs. But yet we applied the criteria that we use to help assess whether the pain is neuroplastic or structural. And those criteria include, does the pain shift? Does it move? Does it turn on and off? Is it better on vacation? Is it worse at work? Is it worse with stress? Is it triggered by light or sound or the weather? Is it in a broad area? Does it shift from one part of the back to the other? Has it been spreading? We have all these conditions, all these criteria that we use. And what we found when you put all that together, we didn't overinterpret the MRIs. 88% were non-structural. 88% of those people with chronic back pain were non-structural. structural. That is incredible. And that's been confirmed in 3 other studies we've done so far in the same numbers, 90, even a little over 90% were non-structural. So this is a huge contradiction, right? Couldn't be more starkly different. Most people are told, and what we think is actually the truth. And so there's nothing more powerful than an idea whose time has come, as you kind of mentioned before. And the question is, whose idea is going to be right? More time will tell, more research will tell. And we have studies showing that the majority of people can actually reverse these conditions. So I think the proof is going to be in the pudding.
It's so interesting because if we bring our car into the shop and we believe there's something wrong and the mechanic says, you know what you need to do is we need to swap out the carburetor.
Right.
When in fact, the issue all along was I was using 85 octane fuel. I should be using 89 or higher.
It sounds like a personal experience you've had.
I was just making this up. It was just a metaphor based on what you were saying. It's actually not. Okay. But it's getting the wrong treatment plan is really costly and probably ineffective in the long haul. So what you were suggesting based on the 222 person study is that 12% were viable candidates for surgery. The other 88 probably needed to find ways to restructure their brains. And I'm wondering, how do you attend to I say you nodding, so I'm guessing I'm taking that as a yes. But I'm wondering, based on that idea, how do you respond when people might say, well, Dr. Schubiner, are you saying it's all in my head?
That's why these ideas have had slow uptake. And that's why I was telling that kind of scenario earlier, so that we can understand that people with pain need compassion. They don't need to be judged. They don't need to be blamed. I saw a woman who had trauma in her life, developed pain and anxiety and depression and fatigue and a whole slew of symptoms. And the doctors were saying, oh, there's nothing, we can't find anything wrong with you. I think you're drug seeking. Her family was saying, well, just get over it. Why are you making all this fuss? No one can find anything wrong. So it's blaming the victim. It's the last thing that we want to do. It's understanding that our brain literally creates what we experience. And this is hard neuroscience. Our brain creates what we see. You can see in your sleep when you dream, right? So it turns out that our brains are filtering billions of bits of visual information that has to get transformed into images in the visual cortex. We create those images. Our brain creates those images based on everything it's taken in our whole life. So we know what different things look like. When someone is at the scene of a crime and they go to a police lineup, they'll often pick out the wrong person, but they'll be sure they're right because what they saw isn't what they actually saw. That's how the brain works. All you have to do is listen to any song lyrics to realize you're not hearing, you're kind of making up what you're hearing because your brain can't take in rap music that fast or any kind of music for that matter. And so what we feel in our body is dependent on our brains. And this is just a neuroscience fact. All pain is created by the brain, even when you have a physical injury. If you're running across the field and you break an ankle, you want pain. Your brain is giving you pain to alert you to stop running on your ankle. But if you're running across the field and a lion is chasing you and you break an ankle, you might not experience any pain because your brain is saying this is more important. So our brain decides whether we have pain or not, period. And so all pain is real. All pain is generated in the brain. And once we realize that, then we can take the next step to say, look, you have pain. Let's not assume it's structural. Let's not assume it's neuroplastic. Let's investigate it and look at your life. So quick story. There's a guy I saw, it's in the book. He's 25 years of severe back and leg pain, so severe that he's reduced to recliner. He can't stand because of the foot pain. He can't sit because of the back pain, can't walk. He's depressed. He's suicidal. He's been to the best, literally the best medical centers our country has to offer. His MRIs and x-rays are all seemingly abnormal. And he's stuck. This is the end of his life. Can't do anything. Well, he sees a physical therapist who says, you know what, there's this different ideas about neuroplasticity in the brain. These injuries you had are 25 years old. They've healed by now. And he's like, well, how can I believe you? How can all my doctors told me the direct opposite? And he said, well, just watch and see what happens with the pain. Maybe you'll find something. So this guy walks into a pharmacy the next week. His pain is a level 5. He sees a long line of he's going to be waiting in, and his pain immediately jumps to a 9. And he's like, WTF.
Exactly.
Unbelievable, because his mind was prepared to say, well, maybe it's neuroplastic, maybe it's not. But that moment was a click moment for him. And then he knew it was his brain. And then he started walking, even though it hurt. But he kept telling himself, I'm okay. I'm not injuring myself. I'm going to do this. I can do this. And he walked a little more and he walked a little more. And 6 weeks later, his pain was gone after 25 years. And now he's playing with his grandkids. He goes to Europe. He's walking 12,000 steps. It's unbelievable. And I'm not saying everybody has that dramatic, quick recovery, but it's possible. And he just used the data. He just analyzed it, investigated using the data that he could ascertain, as opposed to just saying, well, I'm stuck, not just assuming it's all structural. Let's just not assume. Let's investigate. And I think that's really the message that we're trying to convey.
I'm so taken with this. I am also imagining that on the shadow side of this man's experience is the experience of loss, sadness for the time he lost and not knowing. And I think that's a normal part of the grieving process for anybody who gets better. And so it's kind of paradoxical. It's like I get better and then I start ruminating about the fact that, oh my gosh, I lost 25 years. I'm also finding myself thinking about, you mentioned ACEs earlier, just for the listener. ACEs are adverse childhood experiences, and they've been really well researched. They are predictive for many people of having physical pain later in life and a host of other things, including traumas. And then I find myself thinking about HSPs. We've been studying highly sensitive people. Mm-hmm. About 20% of the population according to the research that I've come across, of all species are highly sensitive, and it's for the advantage of the group of that species. They're the people who noticed the smell of smoke or heard the rumbling of footsteps and were able to warn the tribe. And on the other side, it could be akin to 3 children growing up in the same house, seeing the same type of adversity, and each emerging with different later life experience, one of whom has no physical pain symptoms. 1 or 2 of the others might express pain, and maybe 1 or 2 might be what we would call highly sensitive. And I was wondering if you could share if you believe that there is any reality to the idea that 2 people could, or 3 people could be in the same childhood context and emerge later in life with vastly different pain experiences.
Absolutely. Yeah, we see that all the time. I mean, people are born with temperaments. People are born with genetic temperaments, and that's been shown in large studies of children. And some are much more sensitive than others. You can breed mice to be more fearful than other mice. You can breed that, genetically speaking. But they also find that as people grow up, the ones who are highly fearful or highly sensitive don't always develop anxiety issues, for example. It can change over the course of a lifetime. So as you alluded to, it's not only what you're born with, it's also what you experience in terms of the nurturing or less than nurturing childhood. And then it's the later life events as well that can make all the difference in the world. Sometimes people are trained to be more sensitive, so to speak, because of being criticized, because of being not seen or not heard or neglected. And so they tend to learn to not rock the boat, to try to be perfect, to try to fit in, to try to put their needs last and put other needs first, to be the peacemaker in the family. And so different siblings in the family, one might be the peacemaker and try to make everybody happy, but there's a cost to that because their kind of parentification, their concern is the mental health of their parents.
Yep.
And that can be toxic as you go through life when you continue doing that so that you're gaining esteem from the mental health and everyone around you, but you're neglecting yourself. And I can't.
I'm sorry, I have to wedge it because it's too good. I love that personality style that you're describing, the peacemaker, and the burden of trying to bridge and be that could manifest in certainly lower back pain or a host of others. As you mentioned, stomach pain, could be headaches. But I love that image of the personality style of a peacemaker and how specific their experience of pain might be later in life. Sorry, I didn't mean to cut you off. But
one of the stories in the book was from a woman who was a physician, and she was in medical school, and sadly her parents passed away while she was in medical school. And she dealt with it as best she could. But on graduation day, she got pelvic pain and back pain on graduation day of her medical school. Her parents weren't there for her. But the pain didn't go away. And then it continued. So she's having lower back pain and she's having pelvic pain. And she goes to the doctor and they do a scan and she's got endometriosis. So now, is the pain due to the endometriosis or not? So it started in certainly an emotional event. And so she was offered surgery. So some people with endometriosis need surgery. It can cause pain. But she also started reading the literature and she found out that many women have endometriosis without pain. So how was she going to know whether it was that or not? So she went to see a therapist who was working in this mind-body space. And they started talking to her and they realized that she grew up as one of these peacemakers. She grew up never confronting anybody, never really being authentic about her own needs, even with her husband. And this was a lifelong pattern for her. So one day she was in a meeting, and after the meeting, she had this severe flare of pain. And she goes, "Oh my God, my belly is killing me. What is going on?" And she thought about it for a moment, and she realized as part of the meeting, she was asked to do something. And of course, she said yes, because she always says yes. But she meant to say no, which she never does. But she realized, I didn't want to do that. And so she did something she had never done in her life. She went back to the person who asked her and she said, "You know what? I can't do that. I'm sorry, I can't do that," whatever it was. And she felt fear and sweating about taking that step for herself, but she felt pride. And afterwards, she felt a little bit of exhilaration and the pain went away.
Howard, I love that story amazing. So much. And I love the idea that a no to someone else can be the biggest yes to ourselves sometimes. I have this conceptualization. You may have seen the movie Despicable Me, where Gru has these minions. And I think of the cells of our bodies as being akin to minions. And they are either cheering for us when we do something that they like or booing us and maybe saying they're going to go on strike when we do something they don't like. And you're laughing as I say this.
Yeah.
And that's what I share with the people who see me. Boundaries are really, really, really important. Having a full body yes or a full body no and attending to each of these is really important. Otherwise, the body goes on strike.
That woman made a complete recovery. Her pain was completely
amazing.
She didn't need surgery after all. And that's what we're saying is investigate. But not only, and what's amazing about this work, Adam, is obviously it's not just about getting rid of the pain, but it's becoming a better version of yourself. She was then able to have these difficult conversations with her husband to express her needs. Their marriage got better because she was being authentic. And she had better relationships at work and with friends. It's like a side effect, but it's part of that core issue that can cause some of the minions to be unhappy.
Right. And I think about Winston Churchill and his great idea of never squander a good crisis. When we don't properly attend, as you're suggesting, we are squandering a good crisis. We have so many opportunities to improve our brains as the pain expresses itself by doing some of the things that you suggest. In a nutshell, what is I can't believe I'm asking this so late in the game here. But Michael Jordan, for the last minute buzzer beater here, what, in a nutshell, is the process of your treatment? Just, I know there's a lot to it, but
good point. I'm glad you asked. So step one is to make an accurate diagnosis. We don't want to miss a medical problem. If someone needs surgery, if someone, needs medical treatment, we want them to get that. We don't want to miss something. Step two is explain how the brain works and how neuroplasticity can create these kinds of symptoms that are real and not all in people's heads. Step three, once you've done that, if it all aligns, step three is to do what we call pain reprocessing therapy. Pain reprocessing therapy is helping to change the neural circuits in the brain, because the neural circuits in the brain are fed by fear of the pain and focusing on it, or the fatigue or anxiety, and worrying about it and fighting it and being frustrated by it. All those things give our brain the message that there's something wrong. And our brain is predictive processing. It keeps producing what it did the last time, and we keep giving it information. Yes, I'm really sick. I'm really damaged. I'm really broken. And that's the vicious cycle. So getting out of that cycle is to give the brain different experiences, to start to notice the sensations with less fear and less frustration, which is hard sometimes, admittedly, to start to move or walk or sit with less fear and with more messages of safety. I'm okay. I'm safe. I'm not in danger. I'm not actually broken. And try to find a smile and try to find a little joy in being active and doing the things like the guy Gary was talking about. He started walking. It hurt, but he started doing it, but he did it with this completely different mindset. And that has been shown to literally change neural circuits in the brain. And sometimes the symptoms will get better within a few days or weeks or a few months even. That's pain reprocessing therapy in a nutshell.
It's just so incredible. And I do think of this as, it's not the opportunity we want, but the pain presents itself with an opportunity to the sufferer to improve the software and hardware of the brain. But it has to be done, of course, with accurate diagnosis. Of course, at the outset, I'm glad you mentioned that. And with the helping hand of someone to basically guide them as they walk with the pain and unlearn it.
Exactly. And then the next step is often necessary, but not always. It's a different kind of therapy we've developed called emotional awareness and expression therapy. And what this does is it gets at underlying emotional issues that we were talking about. It gets at traumatic experiences in childhood. It addresses people who are putting too much pressure on themselves and neglecting themselves. And it helps them to recognize emotions that have long been held down and in to get them up and out. So, for example, there was a woman who we saw who had seemed like a fine childhood, but her father was unpredictable. He would sometimes yell and come home and yell and scream, shake them, and really scary. But she was fine as a kid. And she grows up and she starts getting headaches one day in her 30s. And they last for 17 years. 17 years, going to the best headache clinics our country has to offer. None of the medications work. Injections didn't help. And so I asked her, what was going on in your life when those headaches began? And she said, well, my husband was fine. My kids were fine. I had a new boss. What was your new boss like? He was unpredictable. He would be fine most of the time. And then sometimes he would yell and scream and debase and belittle people. And that's when she got her headaches. And now she understood them in a completely different light. So she could change how she related to them because she knew there was a reason for them. But she also had these underlying feelings related to the boss and her father going back to her childhood. So what we can do with emotional awareness and expression therapy is recognize that she has underlying feelings of sadness for herself that needs soothing and caring and compassion, underlying feelings of anger and maybe even rage toward people who've hurt her and scared her that need to come out in safe and healthy ways. So she could imagine that little girl or herself expressing that anger toward this person in her imagination in a fantasy arena where she could get that anger up and out in a safe and healthy way and then let it go. and then move back to compassion for herself and to allay any guilt that she has. And when you do that, you go through this process of going through anger and guilt and sadness and move to compassion for herself, and maybe even compassion for her father, who had his own, flaws and own problems, etc. That can be freeing, and we've seen amazing results.
Incredible. Well, gosh, Howard, I am so grateful to you for taking the time to share this with me, and all the more so for you investing your heartbeats in helping people with this troubling condition known generically as chronic pain, which can really screw people's lives. And just these techniques are so empowering potentially. And I am just really grateful to you for being here, for lack of a better term.
Well, it's what I said is I kind of fell into this at the right time in the right place, but this is a worldwide movement of people who are discovering this. And when somebody gets better, they want to tell somebody else, and they want to help somebody else. In the new book that's coming out, Unlearn Your Pain, there's somewhere about 800 people who've put their names in the book to say, hey, I benefited from this work. I want to stand up and say this helped me, and I want to help others doing it. So in a way, it's kind of a movement, and not everybody understands it. It may not apply to everybody. Not everyone's going to benefit, but what we found is that it can yield amazing results. And so my message to people is to just investigate, keep an open mind, and look at this material and see if you think it applies to you or not.
Well, thanks so much, Howard. And I imagine that many of the listeners will be doing so themselves, if not sharing this information with people they care about who may be suffering presently. Thanks again for meeting with me, Howard.
Thank you so much, Adam. Take care. See you later.
This is Dr. Adam Dorsay thanking you for listening to SuperPsyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.